Implementation of the biannual HIV prevention injection by Q1 2025, a comprehensive overview. Summary. The initiative to implement a biannual HIV prevention injection is poised to transform public health strategies against HIV/AIDS, promising a significant impact on prevention efforts. With a dedicated budget allocation of $15 million, this project is strategically structured into 4 key phases, culminating in a public release by Q1 2025. This report provides an in-depth look at each phase of implementation, budget allocation, and the overall significance of this initiative. Key phases of implementation. 1. Research and development (R&D). The R&D phase is crucial for the development of the biannual HIV prevention injection, focusing on the following aspects. Clinical trials. This phase will involve extensive clinical trials designed to assess the efficacy and safety of the injection. Trials will be conducted across various demographics to ensure that the data collected is representative of the diverse populations affected by HIV. The trials will include participants from different age groups, genders, sexual orientations, and geographic locations. Data collection. Systematic data collection and analysis will be performed throughout the trials to monitor the injection's performance. This data will inform adjustments to the formulation and administration protocols, ensuring the final product is optimized for efficacy. 2. Regulatory approval. After successful clinical trials, the next step involves navigating the regulatory landscape to secure necessary approvals from health authorities. This phase includes submission of findings. Comprehensive reports detailing trial results will be submitted to regulatory bodies such as the FDA, U.S. Food and Drug Administration, and equivalent organizations globally. Compliance with safety standards. The injection must meet stringent safety and efficacy standards. Regulatory approval is essential for public trust and the ability to distribute the product widely. Feedback and adjustments. Regulatory agencies may provide feedback that necessitates further studies or modifications before approval, ensuring that the injection is safe for public use. 3. Logistical planning and distribution. The logistics phase is critical for ensuring that the biannual injection reaches those who need it most. Key components include distribution network development. A significant portion of the $15 million budget will be allocated to creating an efficient distribution network. Partnerships will be established with healthcare providers, pharmacies, and community organizations to facilitate the delivery of the injection. Storage and handling. Considerations will be made for the specific storage conditions required for the injection. This may involve specialized refrigeration or handling procedures to maintain the vaccine's integrity. Supply chain management. A robust supply chain will be developed to ensure that the injection is available in sufficient quantities across various regions, particularly in underserved communities. 4. Public awareness and education campaigns. To maximize the impact of the biannual injection, an extensive public awareness campaign will be launched focusing on education. The campaign will educate potential recipients about the benefits of the injection, how it works, and its role in HIV prevention. Informational materials will be tailored to different community needs. Combating stigma. Public health messaging will address and combat stigma associated with HIV/AIDS. Efforts will be made to normalize discussions around HIV prevention and treatment. Accessibility information. The campaign will provide clear information on how and where individuals can access the injection, promoting equitable access to the preventive measure. Budget allocation. The $15 million budget is strategically allocated to ensure each phase of the project is adequately funded. Key allocations include research and development. A significant portion will be dedicated to clinical trials, participant recruitment, and data analysis. Regulatory approval. Funding will also be allocated for necessary regulatory processes, including compliance testing and submission costs. Logistical planning, resources will be directed towards building the distribution network and ensuring that the infrastructure is in place for efficient delivery. Public awareness campaigns, a dedicated budget will support the development and execution of educational materials and outreach programs to raise awareness and promote acceptance of the injection. Common key points. Timeline: the initiative is designed to be completed by Q1 2025 with all phases structured to ensure a swift transition from development to public release. Community engagement: each phase emphasizes the importance of community involvement and education, recognizing that public acceptance is crucial for the success of the injection. Focus on diversity: trials will prioritize inclusivity, ensuring that the data collected is reflective of various populations affected by HIV. This approach is vital for tailoring the intervention to meet the needs of different communities. Complete timeline of events. 2023 Q4, the initial R&D phase is initiated with a focus on diverse populations for clinical trials. 2024 Q1 Q2, clinical trials continue emphasizing data collection and analysis to assess efficacy and safety. 2024 Q3, regulatory submissions for approval are prepared based on trial results, including comprehensive documentation of findings. 2024 Q4, development of distribution logistics and partnerships with healthcare providers and organizations is undertaken to ensure readiness for launch. 2025 Q1, launch of public awareness campaigns coincides with the injection becoming available for public use, marking a significant milestone in HIV prevention efforts. Conclusion. The implementation of the biannual HIV prevention injection represents a critical step in the fight against HIV/AIDS with the potential to significantly enhance prevention strategies. By focusing on research, regulatory compliance, logistical planning and community engagement, this initiative aims to provide a safe and effective preventive measure against HIV. The dedicated budget of $15 million underscores the commitment to making this vision a reality, ensuring that the injection is accessible to all who need it. Through these comprehensive efforts, the project aims to contribute to a future where HIV transmission rates are significantly reduced, ultimately improving public health outcomes globally. The initiative to implement a biannual HIV prevention injection by Q1 2025 is a significant step forward in public health strategies against HIV/AIDS. While the overarching plan appears straightforward, several counterintuitive aspects emerge upon closer examination of the details surrounding its implementation. Counterintuitive information. 1. Budget allocation versus expected outcomes. The allocation of $15 million for clinical trials and distribution logistics might seem ample at first glance, especially considering the high costs typically associated with vaccine development. However, the complexity involved in conducting diverse clinical trials, securing regulatory approvals, and establishing a comprehensive distribution network may require additional funding that is not accounted for in the initial budget. This discrepancy raises questions about the feasibility of the project within the allocated budget and the potential for unforeseen costs. 2. Community engagement challenges. While the plan emphasizes community involvement and education to promote acceptance of the injection, historical data indicates that public health campaigns often face resistance due to stigma and misinformation surrounding HIV. It is counterintuitive to assume that simply launching an awareness campaign will result in high uptake rates. Overcoming entrenched biases and misinformation requires sustained engagement and trust-building efforts rather than just a one-time campaign. 3. Regulatory approval timeline. The timeline suggests that regulatory approval will follow immediately after clinical trials. However, the regulatory process can be unpredictable and may take longer than anticipated, especially if the injection generates questions or concerns during review. This could lead to delays that impact the overall timeline, contradicting the expectation of a smooth transition from trial completion to public availability. 4. Inclusivity versus practicality in trials. The emphasis on conducting clinical trials across diverse populations reflects a commitment to inclusivity. However, ensuring that trials are adequately representative can complicate logistics and increase costs. It may be counterintuitive to prioritize diversity in trials when it could potentially slow down the R&D phase due to the need for extensive coordination and recruitment efforts. 5. Technological integration and distribution. While some sources highlight the integration of technological innovations in distribution processes, this may not necessarily streamline logistics as expected. The reliance on technology can introduce vulnerabilities such as cybersecurity threats or technical failures that could disrupt the distribution network. This counterintuitive reliance on technology could potentially hinder rather than enhance the efficiency of the distribution strategy. 6. Public perception of efficacy. The expectation that a biannual injection will be universally accepted as a viable prevention method may overlook the public's perception of efficacy compared to existing methods such as daily oral PrEP pre-exposure prophylaxis. Users may be hesitant to switch to an injection regimen if they are unfamiliar with its long-term effectiveness or if they perceive it as less reliable than pills they are currently using. 7. Focus on immediate implementation. The focus on a swift implementation timeline by Q1 2025 could lead to rushed decisions that compromise the quality of the trials and the thoroughness of the logistical planning. Counterintuitively, a more extended timeline may yield better outcomes in terms of safety, efficacy, and community acceptance, as stakeholders would have more time to prepare and engage with the community. 8. Assumption of equitable access. The assumption that the injection will be equitably accessible to all populations may not hold true, especially in regions with existing healthcare disparities. The logistical challenges of reaching underserved communities could exacerbate inequalities rather than alleviate them, contradicting the initiative's goals of enhancing public health for all. In summary, while the plan for the biannual HIV prevention injection is ambitious and strategically laid out, several counterintuitive factors raise important questions about its implementation. Addressing these challenges will be crucial to ensuring the success of this initiative in effectively combating HIV/AIDS. The implementation of the biannual HIV prevention injection by Q1 2025 is a significant public health initiative. While many aspects of the report are clearly highlighted, certain important details may be overlooked, which are crucial for the success of the project. Here are some of those overlooked elements and their significance. 1. Inclusion of diverse populations in clinical trials. Significance. The report emphasizes that clinical trials will be conducted across diverse populations. This is particularly important for several reasons. Efficacy across demographics. Different demographics may respond differently to treatments due to genetic, environmental, and social factors. Ensuring that trials include a broad spectrum of participants in terms of ethnicity, age, gender, and risk factors is essential for understanding the injection's efficacy and safety in real-world scenarios. Addressing health disparities. Populations disproportionately affected by HIV, such as racial and ethnic minorities, LGBTQ+ communities, and low-income individuals, must be included to ensure that the injection is effective across all groups. This approach not only aids in the generalizability of the results but also addresses long-standing health disparities. Regulatory and ethical considerations. Regulatory bodies often require data on diverse populations before approving new treatments. By prioritizing inclusivity, the initiative can preempt potential regulatory hurdles, ensuring a smoother path to approval. 2. Logistical challenges and distribution network. Significance. While the report mentions the allocation of funds toward developing a distribution network, the complexities of logistics are often underestimated. Cold chain requirements. The distribution of vaccines often requires strict temperature controls. Understanding how to maintain the cold chain, the temperature-controlled supply chain, is critical for preserving the vaccine's efficacy from production to administration. Partnerships with local providers. The logistics phase will require forging strong partnerships with local healthcare providers, NGOs, and community organizations. These partnerships are essential for reaching marginalized populations who may not have easy access to healthcare facilities. Scalability. As the program rolls out, scalability becomes a concern. The distribution network must be flexible and able to adapt to larger than expected demands or unforeseen challenges such as public health emergencies or supply chain disruptions. 3. Public awareness campaigns. Significance. The report outlines a public awareness campaign, but the effectiveness of such campaigns can be easily underestimated. Combating stigma. HIV-related stigma remains a significant barrier to testing and treatment. A well-structured public awareness campaign must address myths and misconceptions surrounding HIV to encourage individuals to seek prevention. Culturally tailored messaging. Public awareness strategies should be culturally sensitive and tailored to resonate with different communities. This requires understanding local beliefs, language, and communication preferences to foster trust and encourage uptake. Utilization of digital platforms. In an increasingly digital world, leveraging social media and other online platforms can help reach younger demographics and those less likely to engage with traditional media. Ensuring that these strategies are integrated into the campaign can enhance reach and effectiveness. 4. Budget allocation and financial oversight. Significance. While the report mentions the $15 million budget allocation, the intricacies of financial oversight are often overlooked. Allocation transparency. Ensuring transparency in how funds are allocated across the phases will be critical for maintaining trust among stakeholders, including participants in clinical trials and community members. Monitoring and evaluation. There should be a clear plan for monitoring and evaluating the financial aspects of the initiative. This includes assessing whether allocated funds are being used effectively and whether adjustments are needed to ensure successful implementation. Sustainability beyond the initial budget. After the initial rollout, securing ongoing funding and resources will be essential for maintaining the program long-term. Planning for sustainable financing models can help ensure the injection remains accessible to those who need it most. 5. Regulatory approval process. Significance. The regulatory approval phase is critical yet often downplayed in reports. Understanding regulatory landscape. Navigating the regulatory landscape can be complex and time-consuming. Engaging with regulatory agencies early and often can help streamline the approval process and identify potential challenges. Adaptive trial designs. Employing adaptive trial designs can help accelerate the approval process by allowing for adjustments based on interim results. This can lead to faster access to the injection for populations in need. Global regulatory considerations. If the injection is intended for international distribution, understanding and aligning with regulatory requirements in different countries will be crucial. This will require additional resources and planning. Conclusion. While the initiative to implement a biannual HIV prevention injection by Q1 2025 is a promising step towards combating HIV/AIDS, attention to the overlooked aspects discussed above will be pivotal for its success. From ensuring diverse representation in clinical trials to navigating complex logistical and regulatory challenges, each element plays a critical role in the effectiveness and sustainability of the program. By addressing these nuanced yet significant areas, the initiative can enhance its impact, reach, and acceptance within various communities, ultimately contributing to the global fight against HIV/AIDS. For valuable points for in-depth analysis and discussion on the implementation of the biannual HIV prevention injection. 1. Research and development R&D phase. The R&D phase is crucial as it lays the foundation for the entire initiative. This phase involves the finalization of clinical trials to ensure the efficacy and safety of the biannual HIV prevention injection. Key aspects to analyze include diversity in clinical trials. The emphasis on conducting trials in diverse populations is essential for understanding how different demographics respond to the injection. This inclusivity is crucial to ensure that the results are applicable across different groups affected by HIV, potentially leading to variations in efficacy and safety. Innovations in technology. The integration of technological innovations in trial methodologies, e.g., digital health monitoring, real-time data analytics, should be discussed, as these could enhance data collection and participant engagement. 2. Regulatory approval process. Securing regulatory approval is a significant hurdle that can impact the timeline and success of the initiative. Critical points for discussion include navigating regulatory landscapes, analyzing the steps required to gain approvals from health authorities, including potential challenges and delays. This could involve discussions on the differences in regulations across countries which may affect international deployment. Ethical considerations. The ethical implications of conducting trials, especially in vulnerable populations, warrant a thorough examination. This includes ensuring informed consent and addressing any power imbalances that may exist between researchers and participants. 3. Logistical planning and distribution. Effective logistics are vital for the success of the injection's rollout. Points for analysis include distribution network development. The establishment of partnerships with healthcare providers and organizations is crucial for ensuring that the injection reaches various communities. Analyzing the strategies for building these partnerships and the criteria for selecting distribution partners can provide insights into the project's potential reach and effectiveness. Storage and handling requirements. Discussing the specific storage and handling conditions required for the injection, which may necessitate cold chain logistics, can reveal potential challenges in reaching underserved areas. This is particularly important in regions with limited infrastructure. 4. Public awareness and education campaigns. The success of the biannual injection will heavily rely on public acceptance and understanding. Key discussion points include combating stigma and misinformation, analyzing the strategies that will be employed in public awareness campaigns to combat stigma and misinformation surrounding HIV prevention methods. This includes identifying key messages, target audiences, and effective communication channels. Community engagement. The role of community involvement in shaping these campaigns is vital. Engaging local leaders and organizations can enhance trust and credibility, leading to higher rates of acceptance and uptake of the injection. Conclusion. The initiative to implement a biannual HIV prevention injection by Q1 2025 represents a comprehensive public health strategy aimed at combating HIV/AIDS. The 4 key phases: R&D, regulatory approval, logistics, and public awareness, each present unique challenges and opportunities that warrant in-depth analysis and discussion. By focusing on these areas, stakeholders can ensure a successful implementation that maximizes the injection's public health impact. 1. The Tuskegee Syphilis Study 1932-1972. This infamous clinical study conducted by the U.S. Public Health Service involved the observation of untreated syphilis in African American males in Alabama. The participants were misled into believing they were receiving free healthcare, while in reality they were not treated for syphilis even after penicillin became the standard treatment. The study continued for 40 years, raising significant ethical concerns about informed consent, racial discrimination, and the exploitation of vulnerable populations. The fallout from this study led to changes in U.S. regulations regarding human subject research and the establishment of institutional review boards (IRBs) to oversee ethical standards. 2. The HPV vaccine implementation 2006-present. The introduction of the human papillomavirus HPV vaccine represents a significant public health initiative aimed at reducing cervical cancer rates. Initially met with skepticism and resistance in some communities, the vaccine's rollout involved extensive clinical trials, regulatory approval processes, and public education campaigns. Various strategies were implemented to increase awareness and acceptance, particularly among parents and adolescents. Over the years, the program has seen increasing uptake, leading to a notable decline in HPV-related cancers. showcasing the importance of education and community engagement in the success of vaccination programs. 3. The development of the COVID-19 vaccines 2020 to 2021. The rapid development and deployment of COVID-19 vaccines during the pandemic is a notable case in modern medical history. Following the outbreak of the virus, various pharmaceutical companies undertook unprecedented speed in clinical trials, moving through phases to ensure safety and efficacy. Emergency use authorizations were granted by regulatory bodies worldwide, allowing for mass vaccinations to combat the spread of the virus. The initiative necessitated extensive logistical planning for distribution, storage, and public education to enhance vaccine acceptance. The global response to the pandemic highlighted the critical role of collaborative efforts between governments, health organizations, and communities to address a public health crisis. Future outlook: predictions for the implementation of the biannual HIV prevention injection by Q1 2025. The initiative to implement a biannual HIV prevention injection represents a significant advancement in public health strategy, particularly in the fight against HIV/AIDS. As the project unfolds through its 4 key phases, various predictions can be made regarding its impact, adoption, and broader implications for healthcare. 1. Increased efficacy in HIV prevention. As clinical trials are finalized and the injection is shown to be effective across diverse populations, it is expected that the biannual injection will significantly reduce new HIV infections. Public health agencies may report a measurable decline in infection rates within the first year of launch, particularly in high-risk communities. The predictive models suggest a potential reduction of up to 50% in new infections in targeted demographics by 2026. Assuming effective distribution and public acceptance. 2. Regulatory landscape adaptation. The successful navigation of the regulatory approval process is crucial. It is anticipated that health authorities, recognizing the urgency of addressing HIV/AIDS, will expedite the review and approval timelines. By streamlining processes, agencies may set a precedent for future public health interventions, leading to quicker approvals for other vaccines and treatments. This could foster a more responsive healthcare system that can adapt to emerging health threats. 3. Logistical innovations and scalability. The logistics of distributing the biannual injection will likely drive innovations in healthcare supply chains. By leveraging technologies such as blockchain for tracking and AI for demand forecasting, distribution networks may become more efficient. As successful models are established, other public health initiatives could adopt similar strategies, paving the way for scalable solutions that enhance the distribution of various vaccines and treatments globally. 4. Public engagement and behavioral change. The comprehensive public awareness and education campaigns anticipated as part of this initiative will play a pivotal role in its success. Predictions suggest that if these campaigns effectively combat stigma and misinformation, there could be a significant increase in the willingness to receive the injection. Surveys may indicate a rise in public support for HIV prevention strategies, fostering a culture of acceptance and proactive health management within communities. 5. Enhanced global collaboration. As the biannual injection gains traction, it is likely to inspire international collaboration in HIV prevention efforts. Countries may share data and best practices, leading to a unified global response to HIV/AIDS. Collaborative research initiatives could emerge, focusing on vaccine development and innovative treatment strategies, enhancing the global healthcare landscape. 6. Long-term impact on healthcare policies. The success of the biannual HIV prevention injection may influence healthcare policies not only within the U.S. but globally. Increased funding and resources may be allocated to similar preventive measures for other diseases, potentially reshaping public health priorities. Policymakers may advocate for more comprehensive preventive care models, integrating vaccination strategies as a standard practice in public health policy. 7. Potential for new therapeutic approaches. With the implementation of the biannual injection, there is a strong possibility that research will pivot toward other chronic infections and diseases. The methodologies and technologies developed during this initiative could lead to breakthroughs in other areas of infectious disease control, enhancing overall healthcare outcomes and resources allocated to research. 8. Challenges and adaptations. Despite the optimistic outlook, challenges may arise, particularly in ensuring equitable access to the injection across different socioeconomic groups. Predictions indicate that disparities in access could lead to uneven health outcomes, necessitating continuous monitoring and adaptation of strategies to address these gaps. Furthermore, the evolution of the HIV virus may require ongoing updates to the prevention strategy, highlighting the need for a flexible and adaptive approach. Conclusion. The implementation of the biannual HIV prevention injection by Q1 2025 is poised to reshape the landscape of public health in profound ways. With effective execution across all 4 key phases, it is predicted to not only reduce HIV infection rates but also set a benchmark for future healthcare innovations. Continued focus on community engagement, regulatory adaptability, and logistical efficiency will be critical to realizing the full potential of this initiative. As we advance toward the launch, the implications of this project will likely extend far beyond HIV prevention, influencing broader public health strategies and policies for years to come.